I think that the goal from my perspective coming to talk to you folks today is really to share kind of a high level summary, right, of where we've been, where we are now, where we might be going, as well as probably a topic that interests many of you, which is vaccines and what's happening with them and where are we going with those, right? So that's kind of the overview. But of course, I want to try to keep it brief in order to leave time for many of your questions, because I do have another meeting that I have to go to at 1. And so I'll try to keep my part of the talking short so that we have time to talk about some of the questions that you might have. So I am going to try to share my screen and see if that works here. Let's try that out. But I will need like a thumbs up from you, somebody, to if you can see my screen, if that's working out. Yep.
Yeah, it's working.
Great, perfect. Okay, so, recognizing that there are other people from other organizations, so just consider that says Rotary Club and friends, and we'll move on. But, the real pieces that I want to talk to you about are just kind of, what do we know about COVID? What's changed in terms of our knowledge, and what's basically stayed the same? What are the emerging issues about COVID? So things that we're struggling to understand now, or things that are important to learn, but we haven't quite figured them out. Just, more of a personal reflection on, I think, what COVID has taught us, or what it has the potential to teach us. And then a little bit of kind of predicting about where do we go from here, as well as some discussion around vaccines and how they could be rolled out. I chose this picture fairly intentionally because, the person who's looking into the aquarium there, I don't know whether there are other people around that person or not, but I think certainly the whole COVID pandemic has been, a partial exercise in isolation, and how comfortable we are dealing with long periods of isolation in a setting and a context in which, our lives are just tremendously social, and that social and that important social component of our lives has been really, destroyed or picked apart by the risk of COVID, right? I want to bring your attention to another piece of this picture, though, which is that sometimes working on COVID feels like being in the aquarium, where everybody's staring in at you and saying, well, why is it not working like this? And why is it not happening like this? And what about this? And what about that, right? So there is a lot of attention being given and, to inward towards the people who are sort of trying to manage and handle COVID. And so that experience puts a lot of different agencies under tremendous amount of pressure. And so not that is unjust or undue pressure. I mean, I think it's important to have a window into what's going on, but just it's also important, I think, to recognize that, unlike the aquarium, not everything that you see, or maybe even in the aquarium, there's lots of stuff that you see that is happening that you actually don't see. And there's a small segment of stuff that you actually can't see. Like, I think that there are, people want to know a lot about very specific individual personal details about people who have had COVID. And we have to be very, very, very careful about how we share that information so that we don't compromise individuals' privacy, right? It's really nobody's responsibility, apart from healthcare providers, to know that somebody else had COVID or that they were isolating because of COVID, right? So we need to be very careful about protecting that level of privacy around a person's health and medical information, right? Okay, so what are the things that we know about COVID? So one of the things that probably the biggest pieces of knowledge around COVID are how it transmits. And although that's an ongoing discussion in certain areas, I would say our experience and the broader global experience suggests that by far the major mechanism of transmission of COVID-19 is through close contact with individuals that you spend a large degree of time with, either because you are friends with them or you like them, or because you are doing something with them that puts you in their circle for a particular purpose for a defined period of time, like you're providing healthcare to them, or for example, in schools, you're teaching them and it's very challenging to maintain that distance with little kids, or you're in a congregate living setting where people are naturally inhabiting in close quarters, right? There are ongoing kind of conversations about the impact of aerosol transmission. It's important to not mistake that or conflate that with airborne transmission, but the idea that finer droplet particles may spread farther than just close contact, especially in settings that are very confined, potentially very humid, and potentially ones where people are shouting, singing, or otherwise huffing and puffing. So the classic examples there are gyms and nightclubs, right? So those are some scenarios where we've seen transmission beyond close contact, and it's thought that that could be as a result of fine droplet particles. That's still a little bit different than when public health says that something is transmitted by airborne mechanisms, which is that, if we think of those things as being things like measles, where if I'm in a room and you're in a room really, really far away from me, you can still get measles, even though we've not had meaningful contact. There's a little bit of that going on with COVID in some of these settings, but not much of it. The other thing that we learned and that we've, thankfully gotten much more information on is that surfaces are really low risk, right? So there's been lots of conversation around people, wiping down their groceries and things like that. And certainly we don't think that that is a major risk of transmission, right? So if you've been wiping down your groceries and you're still doing that, please feel free to do that if that makes sense for you. But there isn't enough evidence to recommend that everybody should be doing it as a means to reduce transmission, right? Recognize again, we know that COVID has a wide variety of symptoms, right? They can be mild symptoms, they can be no symptoms in some people, although recognize that that's also fairly rare. When we interview people who are initially classified as asymptomatic people, more often than not, they tell us, you know what, I did have something and it did feel kind of like a cold, or I did have a headache and I was tired. Those are symptoms, right? So deciding that someone's asymptomatic is actually a very careful proposition. You don't want to go too widely on that because, when we actually talk to people, it turns out they do have symptoms and they either didn't tell people or they didn't recognize those symptoms as being worse than a normal cold. So there are some people who have no symptoms. There's a larger proportion of people who have mild symptoms, and then some proportion of people has severe symptoms, and then a subset of those people will go on to have fatal or mortality due to the disease, right? And what we've learned over this last year of the pandemic is almost regardless of any other risk factor, age is the most significant risk factor for severe risk of, for the risk of severe disease and death. So in the early days, we were talking a lot about how maybe a 40-year-old with different comorbidities, diabetes, et cetera, was at greater risk. And that might be true within the spectrum of 40-year-olds, but it really isn't true once you start comparing them to 80-year-olds. So an 80-year-old with no comorbidities is at substantially higher risk of severe disease and death than a 40-year-old with any comorbidity. And when you look at the age graph, it's this exponential rise past 60 when you get into 70 to 79 and 80 to 89, et cetera, right? So that's so important. It really means that we have the potential to dramatically impact mortality from this disease by making sure that certain age groups are protected, both through interventions as well as through vaccination. And in terms of interventions, right, you've heard a lot about all of the different public health measures and all the different interventions that we think are going to make a difference, right? There's masking, there's testing, there's screening, there's keeping people away from each other when they're sick, there's this, there's that, there's reducing travel. Like it's, there's a whole gamut of interventions. And some of the best ways that I've heard this described are like, no intervention is perfect. So, it's that Swiss cheese kind of approach. And when you layer a bunch of interventions together, you're hoping to get a pretty good barrier, recognizing that each intervention itself is imperfect. But to my mind, based on the evidence of what we've seen, the interventions that have the greatest impact on disease transmissions are the ones that successfully keep people away from each other, especially people who would have come into contact with each other for social reasons or for prolonged interactions, right? And so the interventions that keep people away from each other are the ones that have the best chance of stopping disease. They also, by the way, stop other diseases, colds, flus, et cetera, right? And we've seen that jurisdictions that have gone really heavy on public health measures that keep people away from each other have experienced really low flu seasons and so forth, right? So the thinking, for example, of staying 2 meters or 6 feet away from someone, is that in and of itself, that distance gives you about 86% protection. That's pretty significant, right? When you think about how much protection you're getting just by staying away from someone. And then I want you to think of all of the other things as layering additional incremental benefit on top of it. But the biggest thing you can do is stay away from other people. Okay. What are the things that we are learning more about, right? So one of the things is that, you're hearing a lot about these variants, and over time, there are going to be so many variants that we're going to have to stop calling them by the places that they were discovered in, right? Because there was a UK variant, then there's a South Africa variant, and then there's a Brazil variant. Ultimately, where it's first discovered is less important than what impacts it has on the population. So over time, there may be strains that result in more severe disease. It's also likely that those strains will also be less transmissible if you follow the pattern of most other diseases that we know, which is that highly severe diseases tend to have, let me say that again. Diseases that have a substantial portion of people on the spectrum of disease that it's severe or highly fatal tend not to spread as easily and quickly because they don't have as many people who show mild symptoms and move among the population, right? So in general, but not exclusively, the things that are milder spread more easily because people with mild symptoms go about their business more often than people with severe symptoms. Okay. So what we don't know, though, we don't think that the current strains that have been identified are result in an increased severity of disease, and we're still trying to work out how effectively would the existing vaccines protect against those strains. I'm going to try to move through this more quickly because I know I want to leave time for your comments. But we also don't know, once you're infected, how long are you immune to COVID after you've had the actual disease, right? Some people say 3 months, some people say 6 months, some people say you've got antibodies for a year or more. I think it's very reasonable at this time to probably say you've got at least 3 to 6 months of protection on board if you've experienced COVID yourself, but it's still hard to say. There is that possibility that you could be reinfected, even though it doesn't seem to be happening that often. And the other thing that we're going to keep learning about, but we also know a little bit about right now, is that the public health measures themselves that we use to control COVID have their own impacts on health and well-being, right? So there's the impact of the disease itself, and there's the impact of the measures that you're trying to use to control disease. And I think that what you're seeing now in terms of sort of this yo-yo between lockdowns and restrictions is an effort to try to maybe find some middle ground. And I hope that we get there, but I don't know if we will, to find a mechanism where the intervention itself has limited impact, but is able to reduce disease transmission, right? But we know it's hard to be isolated. We know it's hard to not be able to do the things that you want to do. And we know it's hard to make value judgments about what things are okay and what things aren't, because different things are okay to different people. Different things have different meaning to different people, right? So somebody might say, well, this thing is open because we think it's important. Well, why not this thing? That's important to me, right? And those are the discussions that then happen. Okay, so what has COVID taught us? These are just personal reflections. They are not scientific reflections, okay? I think we've learned from COVID that we are all connected. Not only are we connected to each other, but the impact of the global community and the impact of globalization on the emergence of diseases, as well as on how they spread through the world, cannot be underestimated, right? And so, you've seen lots of people say, well, we need to stop all of the borders. We need to shut borders and stuff. And remember, the economy is so dependent upon the transport of goods back and forth, right? What if the next pandemic actually was transmitted through surfaces? Would we stop goods? Anyway, these are things that we're going to have to really wrestle with over the next several years, right? As we think about the possibility of emerging pandemics. We're connected, intimately with our environments, right? That is the natural and the built environment around us, and also to our family and friends. And really, I think we've shown how important those connections are in order to get through this very challenging year and the year ahead, right? From the middle one is a public health perspective, right? We are vulnerable. And I think that from a public health perspective, what we've learned from this pandemic is that pre-existing vulnerabilities were made far worse by this pandemic. So if we already knew that income is an important determinant of health, then people on the lower range of income were made far worse by this pandemic, either because their income itself was precarious or because the loss of that income had tremendous detriment to their health and their well-being, right? So that's just one example, but all of the different structural vulnerabilities that exist in our system are made worse by a stressor like the pandemic. And I think it's important for us all to think about those things as we move forward so that as we build back, we don't just build back to a normal or a thing that works for most people or some people, but a thing that really examines what were those vulnerabilities and can we protect against those as we move forward, right? But I also think that the pandemic has taught us a lot about our resilience, right? You know, as communities, even as your community of friends and colleagues and members of your Rotary Club, people find ways to get information, to share it, and to work with each other and to work together to protect those who are at risk, right? What you saw in the UK in the early days of the pandemic was something called shielding, and it was a nationwide effort to protect people over 70 by enabling them to isolate, by providing them the services that they needed in order to do so, and also by monitoring their health and well-being so that they could let somebody know if things weren't going well for them, right? And I think that kind of community level action is important, and we need to promote that and stimulate that, right? Because communities do band together knowing what their needs are, and we need to enable that to happen. Okay, where are we going to go from here? So this year, for me, is all about vaccines. The more we get, the more we'll give. The more that's approved, the more we'll give. I'm hoping that this year will look substantially different from last year because of the presence of vaccines as opposed to last year with the absence of vaccines. Now, I know that, it's an ongoing story. It's not going to be fast enough for everyone. I totally understand that. But when we get them, we'll do our best to deliver them quickly. I think it's important to remember that the level of evidence that we have around vaccines far exceeds the level of evidence that we have for any other public health measure related to COVID. So I want you to think about that for a second. When vaccines are licensed, we study, and maybe I understand that many in this group would already understand that and would feel fairly comfortable with vaccines. But the world that I'm in is one where there's a wide variety in opinions about vaccines, right? And so it's important to remember that when we've studied these vaccines and approved them, we're talking about studies that have had 18, 20, 30,000 people in them, and have examined the impact of vaccines on a group of people who've been given them, as well as on a group of people who have not been given them. And that kind of study, that kind of approach, those kinds of numbers do not exist for the evidence with any other public health intervention related to COVID that we've been using. So that evidence does not exist for masks. That evidence does not exist for travel bans. That evidence does not exist for other forms of personal protective equipment the way that it exists for vaccines, okay? So vaccines have high quality and high certainty knowledge behind them. And so that's why I think we're really focused on making sure that that gets rolled out to as many people as we can. There are still things we don't know about those vaccines, and I'll touch on them in a second. I think we also need to spend this year, not in public health necessarily, but maybe with the research community, right? Because we don't have a lot of bandwidth to do that research, but to understand the diverse impacts of COVID and COVID-related measures, right? To help us now, but also to help us for the future if we think about emerging and potentially future pandemics. I'm hopeful that in the next 5 years, there'll be work in the province to build better systems and structures. Two examples of that are, I think that, certainly public health and probably the healthcare system could use a substantially, light speed interventions related to building infrastructure for information technology, right? We need far better information technology and data-driven tools that work across the province to help understand information and process it and make decisions with it. And I'm just putting in this little plug here, but maybe I don't need to with you folks, is that I think we have an important opportunity to examine not just long-term care homes and retirement homes, but the way that our community and our society views the care of elder people and the care of people as they age, and the importance of building in sustainable resources to manage people's aging in whatever spectrum that comes in, right? Because people age in very different ways and their trajectories are different. And so I would like to reframe this whole thing that we have to look at the long-term care system as we need to pull that back and actually look at how we think about how people get older, how to make that process as optimal as possible for people in the environment that they're in, and also provide resources for people whose trajectories may mean that they need more care. And what does that care look like? And then over 10 years, we're going to see a lot more focus on how do we keep tabs on emerging diseases? How do we ensure that there's an early and robust and collective communal response to emerging signals that there are new diseases or new strains or new patterns emerging? And I hope that we'll gain in the next 10 years better science on the public health and healthcare interventions that can be used to manage pandemics. Okay, things about the vaccine I'll just touch on before we get back to you folks. There are going to be lots of people who are going to come up to you and say, we're going to get those vaccines in arms. There are going to be thousands and thousands and thousands every day by tomorrow, and it's going to happen, right? I would encourage you to significantly doubt that frame, right? That's just not the way that these things work. And so, you're just going to set yourself up to be angry and upset about it when that promise is not met. So what I would suggest rather is that you think about vaccine rollouts as following this methodology: crawl, walk, run. So, right, first, we're going to crawl. It's a new vaccine. It's actually a new supply chain of vaccines. So you're seeing hiccups with that. You're seeing hiccups with data entry. You're seeing hiccups with scheduling. So it's a process. You have to learn how to crawl with it first. You start slow, you learn the process, and you start to coordinate the steps that you need to do it better and faster. That's what we're doing right now. We're going out to long-term care homes and high-risk retirement homes and starting the process, immunizing in small batches of people who are in a place where we can get to them together, and then working through all of the processes as we go and building and changing and making them better. Then you start to walk, right? You build on what you can do and you learn and adjust as you go. And it takes time, but eventually you get to a place where you're running, where you don't need to think about the mechanisms that are involved in walking, and you can start doing it faster. You can start building it. And what are the things that running step needs in terms of a vaccine? It needs a constant and reliable supply chain of vaccine, right? We need to know how much we're getting and when, and those projections need to be reliable out into the future for us to plan, right? Especially for vaccines that need 2 doses. The other things that are helpful but not required, but would be tremendously useful before we get to the run stage, are vaccines that are stable in the refrigerated environment rather than having them be frozen, and vaccines that take on a schedule of 1 dose rather than having to have 2 doses, right? Those 2 things will help us run tremendously because they mean that we can get vaccine out to more places, it's more stable, and we can give it without worrying about when people come back for their second dose. So those are the kinds of things that'll help us get there, but we will be able to get there even with the vaccines that we have now, as long as we build a good process and have a reliable supply. Okay. What products are available? Right now, Moderna and Pfizer are available in Canada. They are very similar to each other, and it's unlikely that anybody would be able to choose which vaccine they get. What you will have, what we want to make sure of right now until there are more studies is that if you get one vaccine and you need a second dose, that the second dose is of the same vaccine. But other than that, it isn't. I would not set up the expectation that you can walk into a clinic and say, oh, I think I'm going to take Moderna, or oh, I think that Janssen one sounds really good. No, what we get is what we're going to give. And if the province says these are the vaccines that go to these specific groups, then we'll be doing that. What are the side effects? So remember, the side effects for both of these vaccines are generally mild. They are much more common in people under 65, and they are more common after the second dose rather than the first dose. We've been seeing some really good response in the groups that we've vaccinated so far, really minimal side effects. But again, we need some more experience with it, but this is on average what we know. It's too soon to tell how long vaccine immunity will last. The vaccine itself is just too new, and people haven't had it for long enough for us to be able to tell. There's the possibility that it will require boosters, but that's years down the road, and we'll have to sort of figure that out as we go. And both of these vaccines are over 90% effective at preventing severe disease, but it's really important that you all know that we need more time before we can actually make claims about whether the vaccine can stop the transmission of disease. I'm going to leave that for 1 second. It's really, really important that you know that right now. Over time, we might be able to make those claims, but we can't right now. And that's because of the way the vaccines were studied, right? So when you give someone a vaccine, the way that they figured out later whether that person has COVID was they waited for that person to develop symptoms, then they tested them to see if that was COVID. Because there wasn't any routine testing of those people in the trial, we don't know if any of the vaccinated people had asymptomatic or mild disease that they passed on to other people because they didn't get tested. Right? So because we don't know those things, we can only say right now that if you get the vaccine, you are less likely to have severe disease. We cannot really say if you get the vaccine, you are less likely to pass it on to others yet. But I hope to be able to do that one day when we have more information. Okay, so I'm going to stop here because I know that you have questions and I only have like 5 or 6 minutes, and I apologize for that. But remember, it's an ongoing experience, right? We're going through this together. We're learning about ourselves and each other and a lot more about the world that we live in, right? And our job in public health really is that we're here to help by using the things that we know to help achieve a healthy community for all of us. And we'll try to keep doing that as new evidence comes forward, as we learn more. We'll try to keep sharing that with you in meaningful ways to help you to be healthy.